Hi, welcome to the Physios in Sheffield. I'm Paul Hatton. I'm one of the physios here, and I'm with Johnny Cassidy, our clinical director. We're doing a series of videos talking around treatment of osteoarthritis of the knee, and hopefully you've seen the previous two. Johnny was asking me questions about injection therapy and how we use that in relation to this common condition. I felt it's about my turn now to turn the tables and ask Johnny a few questions about the rest of the management of this condition. So here goes. Johnny, patients had an injection and they come back to see you for ongoing care. What does that look like?
I suppose the first part of all of that is, what does the patient want to achieve? So if I've seen the patient and referred on to you for the injection, I already know that. If not, we'll spend some time exploring that. And sometimes that takes a little bit of work, because patients come in and maybe their goal is just to be able to stand up and sit down again without pain. But actually, when you push a little bit more at that, people really want to be able to play football with a grandson, or possibly get back on the exercise bike, or there's goals that they want to achieve that they dare not ask for.
Yeah. So what does the treatment look like then? Because we know, we mentioned in the last video, the importance of combining rehabilitation and with injection therapy, and many patients will not need injection therapy at all, will just have rehabilitation and hands-on manual therapy. I know you're a very keen manual therapist and you're a real enthusiast for the benefit of that treatment. Can you tell us a bit about what that looks like, this, the hands-on physio and the rehab that follows it?
I think the rehab thing is, I think when people hear the term rehab, it conjures up images of 15, 20 pieces of paper with different little doodles of people doing exercises on it. Yeah. And that's not what we try to do here. So usually rehab here combines a number of different things. So I'm a really keen manual therapist, as you said, so with my patients I really like to do that hands-on work. Now there's a reason for that, because with osteoarthritis of the knee you lose movement. Yeah. And actually it's about trying to restore that movement in as many ways as possible. And that hands-on exercise, if people need it, we can even take them to hydrotherapy. Yeah. So usually hands-on, particularly to restore the way people can straighten their knee. Yeah. And then from there, it's about basing exercises around the patient's goal. So the exercises we give somebody for to return to cycling are going to be different to the exercises we give somebody to return to football. And also we have to consider other things within the knee. So how is that patient balanced? Yeah. So I've never met any osteoarthritic knee patient who can stand on one leg. So we have to restore that. And we also have to restore the strength and also the range of movement.
So bearing in mind that osteoarthritis starts around mid-40s in some people and goes all the way through to people in their 80s and even 90s, how do you tailor the rehabilitation and treatment for the different, there's potentially a 40-year difference in patients with arthritis, so you're not dealing with a homogeneous group of people that are all the same. How do you rehabilitate somebody who's 80 as opposed to somebody who's 50?
Well, I think it's all to do with what the patient wants to get out of the process. Yeah. And the treatment goals have to be realistic, but also that works both ways. So actually, people who want to really push for something, like I've seen 80-year-old half marathon runners. Yeah. Who want to keep running, and that's completely okay. I think we've come through this sort of journey as physios and musculoskeletal health specialists of knee osteoarthritis started out with, it's running that's making your knee worse. And then people did a little bit of science and a little bit of studying into it, and they went, well, we can't prove that it's running that's making your knee worse, but common sense says it's making your knee worse. And now we're modern science, and there's so much research goes into knees and osteoarthritis now, that actually we can now say with relative confidence that running and load bearing is really beneficial to osteoarthritis in the knee.
Yeah.
So we need to look at load as part of the rehab and really try and push people to achieve the things they want to set out to achieve.
So what about somebody who's maybe in the older end of the spectrum, who comes and needs pain relief, and they just perhaps just want to be able to sort of get to the shops and do some, a little bit of walking, but they haven't got very, very high expectations. Are you okay with that in terms of helping them achieve what they need, as opposed to, some people might feel a bit, I suppose what I'm trying to get at is some people might feel a bit scared about having physio and being pushed too hard or whatever. So how can you reassure people who actually just want to get better but don't want to climb Kilimanjaro?
I think we see the whole spectrum, don't we? We see the people who want to go back to really high-end sport, and we see the people who want to just go to the shops. And actually, what I enjoy most about my role here is seeing all of that. Yeah, I think that if I was stuck on one of the spectrums, I would get pretty hacked off with it. But I love the whole high-intensity stuff. But I also like the fact that, I pop round to somebody's house and we walk to the shops.
Yeah.
What more of an achievement of the goal is, let's go for a walk to the shops.
Yeah.
But it's about being creative and imaginative and innovative and how we achieve those goals.
Okay. So maybe one or two quick questions. We have both seen a number of, probably nearly every patient with arthritis of the knee who arrive having been told there's not really much that can be done for it. Mm-hmm. That's not our experience. But do you sometimes find it difficult to persuade people that actually their expectations need to be much higher because there is a lot we can do for it?
I feel you're trying to bait me on camera because this really pushes my buttons. I think particularly with knees and arthritis is people get a diagnosis of osteoarthritis and a shrug of the shoulders and what do you want me to do about it? And it really winds me up because there's so much that physiotherapy can offer somebody who's got osteoarthritis of the knee. Everything from manual therapy to exercise to injection therapy. And I would like to think that, we have so many people who will tell the stories of they came here and were pretty hopeless, anything could be done for the knee, and actually they're back climbing mountains or looking after the grandkids or whatever it is. Yeah. So what I would say to people is there is so much that physiotherapy can do. Yeah. And realistically, sky's the limit. Yeah.
Thank you, Johnny. I hope you can detect the enthusiasm there, or from both of us, about treating this condition. I hope you enjoyed the video, and as we've said before, there's lots of information on our website and you can dig around and get all sorts of resources there. Do get in touch if you'd like to talk to us a bit more. If you've got a question that you're kind of dying to ask, then please do get in touch. You can use our contact form on the website or just ping us an email, that would be great. Thanks for watching.